connect the electrodes properly. So make sure you have to connect the electrodes properly. So I told you the most important thing is to place the chest electrodes in correct positions. Where to place V3? V3 is between V4 and V2. So you have to place the electrodes correctly in a particular appropriate intercostal space to get the correct ECG, and also connect the limb leads properly. I am going to tell you what is the importance of wrongly connecting the limb leads, and also we wrongly connect your chest leads, also you have some problem in the electrocardiogram. So when you teach your ECG technician or a person who has to place most of the people may not place the chest electrodes properly in that place, or not properly placing that particular chest electrode on that place. So for that, it is easy to remember the traffic signal. So V1, V2, V3 is traffic signal. V1 is red and V2 is yellow and V3 is green. So first V2, V3, you have to remember the traffic signal. And V4, V5, V6, you have to remember BOP. When you hit somebody, it will be BOP. BOP is blue, orange and purple. So V4 is blue and V5 is orange and V6 is purple. So if you teach these colors, rather than they sometimes they do not carefully see which lead it is and keep on looking at the leads, and that time they will waste lot of time in particularly seeing which lead it is, where to place. So if you teach them this type of color codes for a particular chest electrode, it is easy to place. So you have to remember the traffic signal and then BOP. So this is how you have to remember the colors of the chest electrodes. Right, so before reading the ECG, what is very important is to see the standardization and speed. The normal standardization is 10 millimeter is equal to 1 millivolt. So it is 1 millivolt standardization, and the speed of recording is 25 millimeter per second. And please see the patient's, the details. What is the age of the patient, sex of the patient, and what the clinical details of the patient. Then only you are supposed to interpret the electrocardiogram. Please remember, when you buy an electrocardiogram, don't buy an electrocardiogram with the interpretation software, because many times, many of the ECG I have shown you, many times the interpretation software may mislead you. So we'll start with the P wave. P wave is due to atrial depolarization. I told you there is no way we can see the sinus node activity on the surface electrocardiography. The first wave you see is the P wave, from which we infer this atrial depolarization wave is coming from the sinus node by the characteristics of the P wave, the axis of the P wave. So when the P wave, what you have to see is whether they are too tall. Whether they are too tall, tall P wave is right atrial enlargement, wide P wave is left atrial enlargement. Initial component in V1 is tall, is right atrial enlargement. Terminal component is deep and wide in V1 is left atrial enlargement. Whenever the P wave is inverted, the most important lead you have to see whether the P wave is inverted is AVR. In normal ECG, the P wave is inverted in AVR and upright in L1. Whenever the P wave is inverted in L1, it means there may be a dextrocardia, or technicians wrongly connected the right arm lead to the left arm and left arm lead to the right arm. So it can be a true dextrocardia or a technical dextrocardia. So whenever the P wave is inverted in L1, so that's why you have to look at the P wave. So look at this ECG here. You can look at L1. Usually dextrocardia, the whole QRS complex in L1 will be negative, because as you know, the heart is on the right side. So your sinus node will be on the left side. So when the sinus node is coming, the impulse will be coming like this. So the L1 will be looking like AV.